My name is Maya Ramar-Sandratana. I am from Madagascar, founder and executive director of Projet Jeune Leader. So Projet Jeune Leader has developed a model to deliver comprehensive sexuality education in the public school system, specifically lower secondary schools in Madagascar. Through the What Works 2 project, we will be deepening this model and especially deepening our understanding of how this program contributes to reduction and prevention of violence against girls within the public school system. In our experience at Projet Jeune Leader, we have mostly been focusing on sexual and reproductive health outcomes, as well as general health and education outcomes as they pertain to comprehensive sexuality education. We don't really yet understand as a field what the potential of comprehensive sexuality education is on violence prevention and reduction, specifically for young adolescent girls and boys who are living in very resource-constrained settings, in this case in rural Madagascar. Madagascar is a predominantly rural country, and so we have certainly faced challenges within the infrastructure, and that has required us to make adaptations in our program model over the year. When we began working, we were mostly focused on urban areas, but we quickly realized that, of course, rural Madagascar is a priority for these issues, and thinking about how we can best address this within the rural context. I think when we're talking about implementing programs, it's very important to think of a couple of key factors. One of the things that we feel strongly about is dosage. When we're talking about topics such as consent and safe relationships and gender stereotypes, these are not topics that you can address in a one-time sensitization event. These require long-term education within the public school system, gaining trust of students to talk about these topics and really formalizing this education within the public school system. So we believe that dosage is very important, as well as maintaining the fidelity of our educators as they are delivering this program within the public school system. So up until this What Works 2 project, we have been conducting internal quasi-experimental evaluations, looking at the impact of our program on the knowledge, attitudes, and behavioral intentions of adolescents who went through our program compared to those who did not. That has been extremely exciting initial evidence and has really prompted us to wanting to take a look much deeper into these issues thanks to the What Works 2 program. So we will now be embarking on a RCT, randomized control trial, to really look at these issues from an experimental perspective. For the past couple years, we have really been moving towards developing a scalable model for delivering comprehensive sexuality education in low resource settings in Madagascar. We are now moving to scaling, so really figuring out with Madagascar's Ministry of Education how we can ensure that young adolescents across the country, and specifically those in the most rural areas, can have access to this education. If we're able to show that this program not only improves educational outcomes, health outcomes, but also prevents and reduces violence, that will be a very transformational impact for this comprehensive sexuality education field, and also really promoting our model as one of best practice in this field. Projet Jeune Leader has a very unique situation where, as a local non-governmental organization, we have developed very strong ties with the Ministry of Education. I think as we continue to scale this program and really figure out how to institutionalize aspects of this work, I think it is important to really encourage flexible financing for NGOs to allow them to have the flexibility to adapt and to iterate as they go along, especially as we're talking about scaling, which is a very complex topic and requires a lot of intention and deliberation as we start adapting for a much broader and wider audience. Projection Leader has never yet framed itself as an intervention specifically looking at violence prevention. So I think for us, this is very much of a crucial moment to understand what is the full potential and impact potential of our program model. And through the What Works To program, we want to understand, based on some preliminary evidence that we already have, what this program is leading in terms of changes for young adolescents and specifically preventing interpersonal violence, but also school-level violence. We know through this work that asking ourselves who is actually delivering the program, who is standing in front of kids delivering this information is very important when you're thinking about education. This requires very strong interpersonal relationships between an educator to develop the trust with their students to talk about topics that are definitely still considered sensitive in many contexts. So I think thinking about who delivers the program, where we deliver it to make sure we are reaching those who actually need this education the most, and also what are the mechanisms for delivering a high quality program within the constraints of the systems that we are working in. We are very excited about the research aspect of the What Works To project, and I think it's something that distinguishes it from a lot of other types of financing and donor relationships. I think for us, we are very excited to conduct this RCT to be able to deepen our impact, but also really make sure that we are translating these findings and disseminating them and co-sharing them with all of our stakeholders as well in Madagascar to really strengthen the field of comprehensive sexuality education in these settings. I am very passionate about adolescent sexual and reproductive health and rights, as well as comprehensive sexuality education, specifically within the school system. I believe that young adolescence is a really critical period in young people's lives, and I think that we need to increase our investment within this age group, and I'm excited to hopefully help make the transition to adulthood a lot easier for many young adolescents in Madagascar.